Hello everyone, welcome to next lecture in the series of MPPSC Health. In this lecture we are going to discuss the topic communicable diseases, that is Sankramak Rog, its causes, remedies and related government schemes. If you want to watch the previous lecture of this lecture series, you can click on the I button on the top right corner of your screen. So let's begin today's lecture. As always, we have answer writing challenge. I have included some questions from past year's paper like MPPSC 2014, 15 and 17 questions, 16, 17 questions asked from these topics. So you can try and solve these questions and post the answers in the comment box below. We will evaluate, or you can post the answers to our Telegram group. The link of the Telegram group is already embedded in the description box, and the name of the Telegram group is MPPSC Sculpt Academy. So let's begin today's lecture with our first concept, that is communicable disease. Communicable diseases are those diseases which transmit from one person to another person with the help of or with the agents such as wind, with the agents such as insect bites, with the agents such as sexual intercourse, or through physical or direct contact. So, and various other reasons are also there for transmission. In simple words, we can say that any disease which transmits from one person to another person, or which spreads from one person to another person, is known as communicable disease. What WHO says about the communicable diseases? Communicable or infectious disease are caused by microorganisms such as bacteria, viruses, parasites and fungi that can be spread directly or indirectly from one person to another person, and some are transmitted through bites from insects, while others are caused by ingesting contaminated food or water. Means various other diseases are also there which are waterborne, which are foodborne, which are, you can say, airborne diseases. So all the diseases which transmit from one person to another person, which spreads from one person to another person, are known as communicable disease. For example, HIV/AIDS. For example, you can say TB, tuberculosis. And for example, recent example, that is COVID-19 disease, which transmits through direct contact from one person to another person. So these all are examples of communicable diseases. In the next slide, we are going to discuss the examples again. So first is those diseases which spread through physical contact, that is HIV, through oral transmissions, through droplets such as influenza, TB. So, and also you can add corona in this, COVID-19 in this. Second category is contacted with contaminated surface. If someone comes with in contact with a contaminated surface and he gets the diseases, or what are these diseases? Norwalk virus, coronavirus is also there. With food, that is E. coli, blood transfusion, that is HIV, hepatitis B, or water, contaminated water, if we consume, then it is known as cholera. So all these diseases are transmitted if we come in contact with a surface or an object, or if we inhale or ingest some food or water. So these diseases can be transmitted. Others is from bites from insects or animals capable of transmitting the disease, like mosquito, and malaria, yellow fever and plague are the diseases which transmits through mosquito bites. So there are various other diseases which transmit from one or other insect bite. Next is travel through air, such as tuberculosis, measles. If we sneeze, it travels through air. Recent reports of COVID-19 also shows that it can transmit through air. Through the suspended particles in the air, it can transmit from one person to another person. That's why the government gives the guideline to wear nose mask and face mask while we are moving outside. Next, in the next slide, we'll discuss some global initiatives. What are these global initiatives? First global initiative is HIV 90-90-90 by 2020. This is an initiative launched by WHO, World Health Organization. This initiative aims at 90% of all the people living with HIV will know their HIV status. Either they are positive or negative, they will come to know about this. 90% of the people who know their HIV status will receive and are tested as positive will receive antiretroviral therapy, and out of these 90%, another 90% receiving antiretroviral therapy will have viral suppressions. So this is the target. Next strategy is in TB strategy. This strategy aims to end the global TB epidemic with the targets to reduce TB deaths by 95% and to cut down the new cases by 90% between 2015 and 2035. So these are the targets of end TB strategy. The next is SAFE initiative by WHO. What is this SAFE initiative? SAFE is an acronym which stands for surgery, antibiotics, facial and environmental improvement. What was this strategy initiative related to? It was related to elimination of trachoma. Next initiative is WASH initiative. WASH is an acronym for water, sanitation and hygiene. WASH initiative was a joint initiative launched by WHO as well as UNICEF. Next is Measles and Rubella initiative. Measles and Rubella are again two communicable diseases, and M and RI initiative, that is Measles and Rubella initiative, has a global goal to include reducing measles related deaths by 95% by 2015, though it has passed. And the second goal was to eliminate measles and rubella in at least 5 of the 6 World Health Organization regions. World Health Organization has 6 regional councils. 6 regions is divided into 6 sub-regions, and out of these 6 sub-regions, 5 should be declared as measles and rubella free. That is the initiative of M and R initiative. Next, we will look on to some national level schemes. First is National Vector Borne Disease Control Program. Next is HIV AIDS Act in 2017, National AIDS Control Program, Mission Indradhanush, Universal Immunization Program, National TB Control Program. So all these initiatives are national level initiatives. Furthermore, we have some more national level initiatives such as Pulse Polio Abhiyan, MA initiative, that is Mothers Absolute Affection Program, Swachh Bharat Abhiyan, Mission Indradhanush, Integrated Disease Surveillance Program, and National Health Policy 2017. You might be wondering various initiatives which you might not be able to click, that how come these can reduce the burden of communicable disease in the country. So we will look on to some remedies, and then you will be able to link these schemes with various remedies that we are going to look. First is vaccination. The next is proper sanitation, hygiene. Next is isolation and physical distancing. Isolation and physical distancing we have experienced in COVID-19 also. The government is asking us to maintain hygiene as well as maintain social distancing. Next is proper dietary habits. If we have consumed proper diet such as rich immune diet, that which gives the body rich immunity, then those communicable disease can be controlled. Next is use of contraceptives, especially in the case of AIDS, HIV AIDS. Next is disinfection of water and food, especially water. There are various waterborne diseases which occur due to various bacteria and viruses. If we disinfect this water, then various such diseases can be stopped. The communication of various diseases can be stopped. Next is reduction in environmental pollution. Air pollution if we reduce, or other such pollution if we reduce, the means the vectors causing these diseases can be reduced and the disease could be controlled. Next some steps are for treatment, that is screening and diagnosis. One should be screened and diagnosed with the disease immediately after catching such disease. Next is medication such as TB drug, then proper medical care, then therapies such as gene therapy, convalescent plasma therapy. These therapy we will discuss in detail when we study biotechnology or health related interventions in biotechnology. So these can be studied in detail there. Next we have some diseases such as tuberculosis, a communicable disease. What is tuberculosis? Tuberculosis is a communicable bacterial disease caused by bacteria, that is Mycobacterium tuberculosis. Next we have transmitted through air, water, coughing, sneezing, bodily fluids, etc. Next we can see symptoms: fever, cough with blood, continuous coughing and sneezing, also inadequate diets. Fever is a symptom that is commonly seen in various diseases, so you can always guess fever as a symptom in various types of diseases that are caused. Next we have stages. Actually this has the stages such as XDR, MDR, TDR. XDR is single drug resistance. In this stage, the person having tuberculosis is resistant to only single drug. MDR is multi-drug resistance. That is, this in this stage, if the TB patient is resistant to various controlling drugs, and in total drug resistance, that is TDR stage, the person is immune or the person's body do not react to any of the drug that is given to cure TB. Next is treatments and programs. In treatments and programs, if we see, there is BCG vaccine, sunlight, proper sanitation and hygiene will help in the prevention and control of this disease and also treatment of such disease. Programs, if we see, National TB Control Program, DOTS initiative, all these initiatives are there which are launched by government to control TB. Next, we have some data related to India as well as world. Incidence of TB including HIV, that is 27,90,000 persons are TB positive in the country. Numbers per lakh, if we see, 211 persons per lakh population in India are having TB. Global statistics, if we see, is 1 crore 4 lakh people are suffering from TB. Mortality due to tuberculosis is 4,23,000 in the country. Incidence of multi-drug resistance TB is 1,47,000. Incidence of HIV and TB both is 87,000. Mortality due to HIV TB comorbidity, मतलब दोनों की वजह से होने वाली death is 12,000 in the country. So there are various such indicators, data related to tuberculosis that we can study. Next, we have HIV/AIDS. In HIV/AIDS, what is HIV/AIDS? HIV/AIDS is a communicable viral disease caused by HIV virus. Next is transmitted by blood transfusion, bodily fluids, sexual intercourse. Next, we have symptoms. Symptoms include continuous fever, weight loss, white spots on skin, immunodeficiency, etc. Next, we have diagnosis test. ELISA test is conducted to diagnose HIV. That is enzyme linked test. Next is treatments and programs. In treatment and programs, if we see, there are antiretroviral drug, use of condoms as a prevention to these diseases. Next, we have programs, that is National AIDS Control Program, HIV/AIDS 2017 Act. So these are some programs. Next, we have data point. In data point, the report of government cites that in 2017 HIV prevalence in India is estimated at 0.22%, with approximately 0.25% among males and 0.19% among females. These percentages are of the total population of the country. Next is in 2017 an estimated 69.11 thousand people died of HIV/AIDS related causes nationally. In India, India is estimated to have had 22.67 thousand HIV positive women who gave birth in 2017. So these are some facts related to HIV/AIDS. You can make such tables for other diseases such as corona, such as measles and rubella, such as trachoma. These communicable diseases are also asked in exams, are probably to be asked in exams. So you can make such table for those things also. As we have seen, AIDS has been asked again and again in the examination. So in this year 2019 or 2020, COVID-19 or corona can be asked as a probable question. What are the treatments, what are the symptoms, all these questions can be framed from these disease part. So you can prepare such tabular columns for other diseases as well. So thanks for watching the lecture. You can subscribe us on Sculpt Academy on Facebook, Instagram and YouTube. And also you can join our channel on Telegram, that is MPPSC Sculpt Academy. In the next lecture, we are going to discuss about non-communicable diseases. Till then, stay home, stay safe, study online. Thank you.